This is the first video in a series of videos by Dr. Darshan Kaur, and the topics are mental health issues. If you want to see more content by Dr. Darshan Kaur, then do give this video a thumbs up and comment so that you can give us some encouragement to produce some more of this valuable content and put herself out there and answer your questions and deliver lots of value to you guys and help as many people as possible. The topic today is suicide.
Yeah, I mean, in light of recent events where a young male in Canada took his own life, and also a couple of other incidents that we've heard in the past 2-3 weeks, we felt it was important to raise awareness about mental health and suicide, and let you know about the sources of support that are available if you yourself have considered taking your own life or know anybody else who is considering or has attempted to take their own life.
Okay, let's get right into it then.
Yeah.
If you know someone who has, or if you have yourself,
Yeah.
are there two different avenues to go down, or what are the sources of help?
Okay, so if you know somebody that has disclosed to you that they have considered taking their own life, then there are a number of services that are available that you can connect them to. So Samaritans is a 24-hour helpline, and that there are trained volunteers there who provide support around any emotional difficulty. It doesn't have to be suicide, it can be any kind of mental health problem. So Samaritans is one. There's another one, Calm, that's for young men who are having suicidal ideation, which is thoughts about ending their life. There are a number of sources out there of support.
And we'll link to all of the ones that we've looked up
Yeah.
in the description box below. So Dr. Darshan's done that for you guys. So take a look in the description box below for more details on those separate sources. And for each circumstance, there may be different ones. Like young males may want to.
Yeah.
May
Also,
grab
Childline is one for young people under the age of 18. So these are all helplines. But in terms of getting some face-to-face support with a therapist, the best bet is to go through your GP. If you've got some kind of relationship with your GP, you can go and see them and let them know what you're struggling with, and they can direct you to therapeutic support in your area. Other face-to-face support, you could self-refer to some services. So, for example, in our area in West London, there are psychological wellbeing services. So if you Google psychological wellbeing services in your area, there usually is something that will come up that will have, and then on the website you'll be able to refer yourself, or you'll call in, or you'll fill in a questionnaire, and then somebody will get back to you.
What if you don't want to tell your GP?
Yeah.
Because you want support, but you don't want it to go on your records.
Yeah, that's a really difficult one. It's a question that most people do ask when I do refer them to their GP. If you go via your GP, then your GP will have it on your health record, but it's not something that needs to be disclosed to your employer or anything like that. If you self-refer to one of these services, then again your GP does usually have to be informed, but they don't need to be informed about the specifics of the support you're getting. So there wouldn't be any specific kind of disclosure.
So when you say self-refer,
Yeah.
in the UK we have the NHS. Is that still through the NHS?
That's through the NHS. There's also private counselling and therapy that you can access. And if you do access support of that kind, there's an option of it not going on any kind of record because it's a private.
What do you mean
service.
by private?
So there's an association of psychologists, psychotherapists and counsellors, and there's one called the BABCP, British Association of, so this one's about clinical psychologists.
And what
I
if
can't
you,
remember exactly
what if you want
There's
to
also the BPS, British Psychological Society. I'll write links to all of these. You can go on their website and type in the emotional difficulties that you're having, so anxiety, depression, bereavement, and then you can type in to search within a 10 or 5 mile radius, and then it will come up with psychologists, and you can usually phone them and have a conversation over the phone and then decide whether you want to have therapy with them.
So that was my next question. So in order to screen these therapists, is there some kind of particular questions that you should be asking, or when you give them a call, what should you say?
Yeah.
If you've got, let's say, a list of 5 in the Southall area,
Yeah.
and you don't know which one of them to go for. If you're from the Sikh community, you might gravitate towards somebody who's Sikh, maybe, or
I think with this kind of thing, it's trial and error. You get to have a sense when you talk to somebody on the phone as to whether you feel like they'd be compatible. You might want to ask them what therapy would involve. You might want to ask what kinds of difficult people they've worked with before in the past, and I think generally just you would get a feel from the conversation as to whether you feel comfortable talking to that person, you feel like you're being listened and heard, and they might even help you to think of some a plan, a treatment plan that you might be able to work through together, and whether that would sound like it would help to you, that kind of thing.
And for people in our community, if the therapists around you or the ones that you can access in whichever country you're in are not from the same background, so in our specific scenario that would be Sikhs. So if they're not Sikhs, what kind of advice would you give to them if you might be going through some issues like related to our community, to our culture, right?
Yeah.
Potentially, let's say like it's low self-esteem due to looking differently, for example, right? What advice would you give to somebody who's reluctant to reach out to services or support because they feel like the person's not going to understand and they're just coming from a completely different framework of understanding?
That's understandable, and the thing is that we as psychologists are trained and put a lot of effort and time and work into reflecting on ourselves and the worldviews that we bring to the therapy, and so we should always be thinking about the patient that we're working with and their constructs, their norms, their values, the things that might inform the decisions they're making, that kind of thing, and aware of how our own training and our cultures inform the work that we do and what we might be thinking about the patient. So with that, we try to be as open as possible and non-judgmental. That's one of the kind of cornerstones of being a therapist, that we're non-judgmental and that we're aware of our attitudes and our values, and that they don't influence the therapy in an unhelpful way. So although some people are reluctant to seek help from somebody who is not like them in terms of their culture, sometimes it can be quite refreshing to speak to somebody from a different culture. Firstly, there's less of a feeling of judgment. You feel like that person's not, if they're from a different culture, then they might not, somehow they won't be related to you or something like that. There's always this fear that it's going to get back to somebody in your community, so that won't be there. Although it wouldn't get back because therapy is completely confidential. But there is always that sense of fear of judgment. I see a lot of people who aren't Sikh and who are not Punjabi, and I often say at the outset that we're from different cultures and we have different understandings of things, but let's always talk about that and be open about that when we're talking, and let me learn more about your culture and your values and help me to understand you better. So therapists should always be open and inquisitive, trying to really understand from the client's point of view.
And lastly, you mentioned services that you can access if you feel like if you're having some of those thoughts.
Yeah.
What about if someone's confided in you and said, your best friend has said they've been having these thoughts, so they're feeling really down or they're really struggling. You can tell something's changed them and they're not the same as they used to be. So we've
kind of strayed away from the topic of suicide, really, haven't we? Does that you want to come back? Should we come back to that and think about if somebody is in an immediate risk? So somebody's saying to you there and then, "I want to take my life right now." In that case, that would be difficult for anybody to handle. You would call 999. Stay with the person until they're able to be seen to. That would probably be by a community mental health team or some kind of, they call it liaison psychiatry in hospitals, or you could escort them to a hospital yourself.
If you're not with them, if they call you on the phone and say they're going to kill themselves, would you go and see them, or would you just call 999?
I would call 999 and go and see them. Yeah.
Okay. And let's say they've said they've had these thoughts before.
Yeah.
but they're not saying they're in immediate risk,
Yeah.
then what should you do?
So that in that respect, you should, in terms of actions you can take, trying to connect them to the phone lines I mentioned before, try and encourage them to access their GP. But in terms of kind of how you converse with somebody who's telling you those things, listen non-judgmentally. The best advice I could give is not to overreact and not to show that you're noticeably distressed by that, and try to kind of just listen open-mindedly to that person. Because isolation is one of the biggest risk factors in determining whether somebody does take their own life. So if they feel as if they're connected to somebody, or somebody's listening and somebody understands, that can be a really positive thing for them. At the same time, it's very difficult to be in that position, and I would recommend that you get support of your own. Even psychologists find it hard to deal with somebody who is telling them that they want to end their life. So we have supervision and years of training and the whole support network behind us. So if you are in a position where you are listening to somebody else who is telling you that they are struggling, try and get some support yourself. You can call Samaritans yourself. They can support you through the process of supporting somebody else. You can even ask the Samaritans to directly call the person in question, whether or not they've consented to it. You can give the number and they will anonymously call that person and try and offer support. So that's
some
helpful.
Really valuable gems of information there. So thanks for sharing that. Lastly, to summarize or to close, is there anything you want to say?
I think the biggest thing for somebody who's in distress is to feel that they're not alone with what they're struggling with. So if you are in a position to be able to listen to somebody and connect them to a service that might be able to help them, that will be really invaluable for them. And I will enclose write somewhere. I've written a list of the sources of support that if everybody can have a copy of that, then if somebody is struggling, they can confidently say, this is a service that might be able to help with this.
Brilliant. Thanks a lot for watching. Please do give this video a thumbs up and leave a comment so that we can get lots of engagement and get Darshan to record another one of these videos. So thanks again, and see you on the next one.